I'm Beth Clayton, a nurse anesthetist, and I practice at the University of Cincinnati Medical Center. It's a level 4 maternal care unit and an academic medical center. I primarily work with obstetric patients. Our patient clientele can be challenging, both from a weight perspective, their BMI, and also some of their vertebral anatomy. Because we're a high-risk maternal care referral center, we do get patients that are challenging. I'm always looking for ways to optimize my care for my patients, and I find that the technology that Accuro provides would allow me to facilitate a more effective epidural and decrease my complication rate, which optimizes my anesthetic and also the patient experience. I find the Accuro most helpful in my larger patients with a higher BMI, where I'm unable to easily palpate traditional landmarks. And with the Accuro, it is able to help me identify the vertebral column, both in the midline and also in the intervertebral space. The Accuro decreases your complication rate. By facilitating the identification of midline, you're less likely to obviously be lateral in your epidural space. And a lot of our complications come when you're lateral in the epidural space from hitting an epidural vein or possibly getting a paresthesia. The other thing that it helps us do is decrease our epidural failure rate. Again, if we're able to identify midline and our catheter is most midline, that will give us a more effective bilateral block. In addition, the Accuro provides you information to the location estimation of your ligamentum flavum, so you're able to decrease your incidence of inadvertent dural puncture and the potential possibility of a development of a post-dural puncture headache. We had a patient that had a prior attempt by 3 different providers with a high BMI, and I was asked to come assist and could I bring my Accuro device. And so I went in and I scanned this high BMI patient, identified the intervertebral space, and was able to successfully place an epidural with 1 attempt. And I did not have any redirects on that particular patient either. And we had a very successful placement of a labor epidural that lasted that patient's entire laboring process. I do recommend Accuro to my peers. I think anything that we can do to optimize our epidural analgesia or anesthetic or spinal placement is essential in order to increase patient safety and patient satisfaction. I also find as a provider, it gives me better satisfaction as well because I'm able to be proficient and successful.